My name is Teresa Sipos, Teresa Durbach Sipos, and I currently work as a chaplain at a state psychiatric hospital that includes mental health and addictions treatment. And I also teach nursing. I've been an RN since 1980, and I teach as an adjunct nursing professor at a local community college. Thank you for asking. I'm attending a Doctor of Ministry program at St. Mary's Seminary and Graduate School of Theology in Wickliffe, Ohio. My project prospectus is teaching student nurses spiritual health care, and starting with the nursing diagnosis, NANDA approved nursing diagnosis of spiritual distress, and nurses providing emergent spiritual health care for patients. All hospitals are required to provide some type of spiritual health care, and it's required by Joint Commission. It's, I believe, a 2005 Joint Commission standard. What's typically done is during the nursing assessment, a nurse will ask what the religious affiliation is, and then do you want to see someone in pastoral care, spiritual care, or a chaplain? I would like to share very much in honor of my mother, Joanne Durbach, who was a nurse for many years, 50 years, was in hospice. While she was in hospice, all five children were with her constantly. While I was with her, a volunteer walked in offering her services. So she offered Reiki, and I refused, politely refused, and that didn't go well. In my line of work as a chaplain, you don't provide spiritual health care unless you have permission, and you don't provide any type of spiritual health care without informed consent. I had ended up having to argue with this volunteer who walked into my room, my mother's hospice room, at her deathbed, literally. I'm on one side of the bed. My mom is in the bed, barely conscious, in fact, not conscious. And the woman's down the other side insisting that, oh, she's going to do Reiki. It's really helpful. I said, no, thank you. We're Catholic. And our bishops teach that this is not okay. And her response was, are they still teaching that? I said, yes, they are. So no, thank you. So again, she started again. It took 4 times to get her to leave. Finally called the nurse in, asked the person to leave. I also talked to the chaplain, and I also asked the nurse to put in the chart to record that we're Catholic and no, we don't want Reiki. I should not have had to go that far. I think she would have easily bulldozed someone who was not as educated or aware of what Reiki is. What's interesting is right after this event happened, within a minute, the Eucharistic minister, Catholic Eucharist minister, was coming down the hallway and came in and brought us communion, which we would have missed with this false practice.